for pediatrics and women, basically the ones that want require more privacy.
Yeah.
And then on this side,
This is really good. Reduce and incorporate. You see that?
so on this side we have like a small kitchen here. For example, we have a small kitchen here. This is where we do the triage. When we have patients coming in, we take their blood pressure here, we take their measurements here, we do the data entry, and then we move them to the other consultation room. And here we have a small kitchen because, for example, with days like this, we're gonna stay here until 7 p.m. Usually we just fry some plantains or something just really quick.
Something to survive on, yeah.
Exactly. And let me show you on
This
the
is
back.
funny too. Here's the reduce,
Exactly.
eliminate, and
So
incorporate.
this campaign was called Eat Like Your Grandma.
Yeah.
And it's coming back to
To
the
a
values
good-
of eating healthier like our grandmothers and grandfathers used to do.
Eat local, fresh, and wash the hands.
Exactly. So still eat your rice and beans, but in a very controlled portion.
Yeah.
So it tells you reduce salt, sugar,
Eliminate
candy,
diluted
fats.
sugars.
Exactly.
Eliminate alcohol? Never. Tobacco? Yeah.
And the team now is preparing for the women's healthcare. So we have Speckles there, Dr. Stefan is doing the counting, just to make sure that everything is okay. Maria is one of the community health workers. She lives just in front of the
So yeah.
just right
So they're all like local.
exactly.
Part of the, like you said, part of the community.
Exactly. So hopefully by the beginning of 2021, the center is trying to look for funding to do proper flooring with ceramics and fixing a little bit of the seating, and then we're gonna habilitate the space a little bit better. This is some of the new furniture that we were able to get on this bed that was donated by the hospital. So we have one consultation here for OBGYN, and we have one on the next office. For MSDs, we prepared this of like 3 consultation spaces, and for educational courses before COVID, we turned this into a classroom. So we have workshops for the Healthy and Happy program here, and we also have workshops for the community health workers that are here, and it's very difficult for them to go to the center.
Man, is this something? Is this remote or what? Like Dr. Living Strange, right?
So we usually shop book on the, so we have the older.
Wow.
Here.
Wow.
We are just preparing everything and sterilizing everything.
Yeah.
So we're gonna have 50 women today and 100 women tomorrow.
Wow.
And
Oh, funny, huh?
No, yo quiero saber qué tú hacías ahí.
Catherine va a organizar la capacitación junto con Cari.
Kick off of it.
Cari is one of the CAWs of the Healthy and Happy program, and Catherine and her will be organizing these workshops at the IIC in collaboration with the Pitch for the kids and their families.
Será un placer.
It will be a pleasure
Colaborar con
for
ustedes.
her. Since 2009, she has
She's
been
been with you
part of
since
HHI.
2009.
She was a community health worker here in Severed. And ¿en qué año tú fuiste parte del staff?
En 2015.
In 2015, she became part of the staff.
Okay.
No sé si tú quieres explicarle un poco de qué es San Infeliz en español.
No, San Infeliz se trata de buscar personas con a riesgo de padecer presión, azúcar, formar grupos de enseñar cómo las personas pueden tener una dieta saludable, caminar, correr, así como que se forman grupos, entonces le enseñamos a las personas a tener una vida más saludable. Ven, mi amor, porque no van a entender.
So she's saying that her program teach people how to adopt healthy habits into their lifestyles and improve their health outcomes. So, ¿qué cosas hace, por ejemplo, en el programa?
En el programa se hace el tamizaje.
We do physical evaluation of the people that the beneficiaries, anthropometric measurements, blood pressure, glycemia, body measurements, just to see the progress in terms of losing weight, improving their glycemia levels.
Through lifestyle changes too.
Exactly. Catherine also organizes this competition. It's like a healthy master chef where people compete like in these fun activities to learn how to cook healthier food and just harvesting things that are accessible to them. Cosas que están al alcance de ellos, comer cosas que están a su alcance.
Mensualmente se da la charla, entonces cada 4 meses medimos el cambio que ellos han tenido según lo que nosotros le hemos enseñado.
So we train the CHWs every month, and then the CHW train the people in the community, and every 4 months we repeat the evaluation just to see how much they are improving. And he goes by the name of our founder, Craig. He is the president emeritus of the board. He has been supporting HHI among the Dr. Brad.
So this is something
Here?
that the original center. Out here in the rural center. On the
Buena.
You get a shot of that.
Entonces,
Came in that view.
Dígame, Juan.
no, mi amor, eso te la Él de ahí, él de
Oh, into the wild, the nature of the mountain. Huh? See that big papaya tree over there? These are bananas.
Happy to see you. Loves you.
The puppy excited? Wow, this is neat, huh? This is neat, huh? Muy intense.
question I had for you, doctor, was this patient, which we took about 15-20 minutes to get to, is this one of your furthest clients to go
Actually,
to?
no, this is one of the easiest to go to. There are people that live in very remote areas where we have to go on a motorcycle because of the geographical area, and then we have to leave the motorcycle and walk about 30 minutes by foot.
Phenomenal.
He has something for me,
Oh, you have something for them?
and he bought, lo compraba
Look, he used to buy the...
Yeah, he used to buy the
when
medicine.
he could,
Yeah,
when
yeah,
he could,
yeah,
and one day yes, one day no,
yeah.
and after that,
It's too much.
yes, it's too much.
Muy
26,
cara.
The treatment because he was not able to
26
afford it. So it was
per
one day yes,
Yes,
one day
yeah, I
no.
remember he said 26.
26.
Ingresé ahí porque antes yo tenía que dar por una pastillita Cadicol, tenía que dar 26 pesos por esa pastillita, por una sola. Y ahora, después que ingresé ahí, me la dan gratis. Tengo que sentirme bien.
It's free now?
Gracias a Dios y a ustedes.
De nada.
Thanks to
Y yo
them.
me siento agradecido y con la doctora también.
Wow.
Y
Before he used to spend a lot of money in pills, and
Yeah.
now
It's free.
having us is free, so he
So
doesn't
good.
have to worry about that. ¿Cómo se siente cuando Joandra lo visita, cuando la doctora lo visita? ¿Se siente tranquilo, confiado?
claro, a veces Joandra no me encuentra y yo estoy aquí bromando con zapatería y entonces no se ve allá afuera. Y ella me llama, si yo estoy aquí yo respondo. Sí, porque a mí me mandaron a estar, este hombre me mandó a estar acuartelado aquí. Y que ni siquiera respondiera. Ese fue Joaquín.
So Joaquin was telling
Sí,
me that if people come to look
pero
for
yo hago
him,
así,
to avoid
bajo una
people, crowded
persiana, y
people
miro
here in
por
his
ahí
house
si yo
because of the
veo
COVID.
quién.
For COVID.
But when he hears Joandra, he comes out to receive her.
Seguro.
I would too.
Yeah.
She's beautiful.
So, algo más, doctora. Everything is great with him, so it's a very successful consultation. Todo está bien con usted, Manuel, se está portando bien, está comiendo bien, los resultados también, así que...
Sí, yo lo que no estoy comiendo mucho arroz porque casi comida ninguna estoy comiendo mucho porque antes yo comía más, pero el arroz no puedo comerlo casi después que yo como a las 12 no puedo volver a comer arroz. Si no hay nada que cenar, no vuelvo a embromar con arroz.
He's not trying to eat a lot of rice now
No.
because he sees that a lot of improvement.
Yeah.
So he's trying to limit himself at one time a day, eating rice
Yo
only
lo
one
tengo, acá
time.
por si acaso usted no lo sabe.
And the notable improvements that have come from it.
Yo lo
weird
tengo
how it
desde
happens,
que me salió la
And how did he find out he was sick? How
So
had it?
usually patients like him go to our MSDs
And get
with
tests?
an appointment because they either have any type of symptoms related to diabetes or pre-diabetes, and then when he goes to the health center and we have analysis on him, then we discover that he might have exactly
So they
or
come in for checkup.
exactly or either the CHW, since they are in the communities, some people come, hey, my head is hurting. Usually when I wake up I have a tingly thing in my hand, so that is exactly a suspicious case, and usually they are referred to Dr. Stephanie. So
How
Dr.
about
Stephanie.
Manuel? How did he find out?
Manuel, ¿cómo usted llegó a Horizonte? ¿Cómo se enteró de Horizonte?
Bueno, eso, la gente hablando y cosas, y yo me noticié de que esa gente estaban haciendo obras como cosas, y yo traté de acercarme a ellos, y ellos
Yeah, I heard that his blood sugar's coming down.
We took the
Improvement.
test to
Tremendous.
the lab, and Dr. Stephanie took the blood sample
Yeah.
here in his
So
house.
this is an ideal example of what you want it to happen.
Exactly.
This is the way it should be.
Exactly. Ahora sí, mano, ¿cómo se siente? Ahora sí con
Sí,
HHI.
podemos hablar.
No, he can talk.
Porque ellos me han educado y ellos me dicen que yo no puedo estar hablando cuando me está
They have educated him that he cannot talk.
Tranquilo.
están tomando la presión.
That's true.
Listening to his instructions.
Yeah.
Okay, so
That's a great
is
photo.
general comments?
Consulta. Ujú, en inglés.
¿Quieres que no me termine?
Diga.
And every month we go to the house, to the patient, and we check everything, the blood pressure, blood test, and we talk about the things that they have to change. We talk about food, we talk about exercises, we talk about everything because we try to educate the patient integrally.
So they can help themselves.
Yes, our goal
Yeah.
Yeah, mission,
is
objective, goal.
to change the lifestyle.
Yeah.
The patient understand that they have to work for his health,
Health, yeah.
and we are to acompañar,
Accompany them.
Yeah.
yes, and educate. But it's not only medicines.
No.
We have
Lifestyle,
to,
nutrition.
yes, everything.
Again, total comprehensive. All comprehensive.
So now she's doing the blood test for the glycemia test. She have her own equipment. Also, she have a backpack that she travels all the time, and she have all the time with.
And so you call her a health promoter.
Exactly.
That's what she
So
said,
it's-
yeah.
Exactly. She's a community health worker or a health promoter.
And then when she said, she stood up and
Sí,
said,
entonces
many of them were health
está bien,
promoters.
está bien. Entonces, tiene asiento
He's
sí,
doing
pero
good.
ya usted toma. Y tiene que estar por debajo de
He's
los
taking
asientos.
good. That's good.
Acá una flor roja.
Yeah.
Y es bueno para hacer eso porque ahí en la sombra no se
Manometer. That's it. It's mucho.
Entonces eso se pega hasta en el suelo.
Palabra grande, yeah.
So
¿Hace qué tiempo te
Stephanie,
comen?
Yo ahorita.
patient Dr. Stephanie Sheck.
Como media
He
hora.
recently
Más
had
de
a
media
blood
hora.
test. We have yearly analysis for people that have diabetes and hypertension, just to make sure that the person know any type of issue with their kidneys.
Está bonito así.
He just got two though, because he's living pretty
Yeah,
open and organic.
exactly. Exactly. So usually, for example, probably because of stress, he lives by himself now.
Escúcheme, porque esa gorra de trabajo, ay, está grande.
Ahora está más bonito.
Una cosa que sea amigo.
Is this amazing?
Sí.
Like here in the house.
Good twice a month. Just to verify.
Pero
Look at that. That's
ella
something.
sí. No, porque si es síndico y ya como de botellado, no, que no sea nada.
Chili peppers.
Eso es hombre mal, ya.
Le pregunto que hace qué tiempo usted comió, porque quiero hacerle un rastreo.
Sí.
Esa, mire, todo
Lechosa.
salió bien. Los análisis, los riñones también, el páncreas está bien, todo. Pero ese día, ¿usted no había comido nada? ¿No tomado café? Sí, usted me
If that day he ate something, or if he had
No,
breakfast.
cuando me
Our values strange.
Exactly.
Something.
no había comido nada.
Nada.
No.
Says he didn't have
Porque me salió en 154.
So his
No
blood
está muy mal,
was
pero no
showing
está
on 150, although it's kind of high, because
Entonces le vamos a hacer un rastreo.
he was fasting.
Para ver
However,
cuánto la está manejando después de la
last
comida.
Dice el
analysis,
azúcar.
he was super hot. So
Pero,
he went to work,
pero
but he
mire,
still
después
had to
todo
work a
lo
little
otro
bit.
está bien. Y la orina también salió bien.
So the urine analysis was okay, it was great.
Él es Manuel, es uno de mis pacientes que yo chequeo mensual. Y cualquier inquietud también él me manda a decir o se dirige a mi casa.
Dos tiempos son per mes.
Usualmente 2 veces al mes.
Es, sí. Le voy a tomar la presión.
So the reason why we start talking is because usually
¿Cómo se ha sentido usted?
Yo, en estos días yo estaba medio malo, pero era de la columna.
some personal questions like how are you doing?
Se sienta cómodo atrás, la espalda.
Ay,
Do you have breakfast? Then we verify the meds. If he's taking them correctly, we count them just to make sure that he's not taking too much or less. Then we
de una que no
triage, which we do
Recuerde que
Ah, no, de esta no me
desde el
the
kit
blood
de los
pressure,
medicamentos
we do the
no se le
glycemia,
aumenta.
if he's diabetic.
Really comprehensive. Ever seen such a thing? Wild. This is weird, isn't
Sandra, ¿cuántos años tú llevas en Horizonte?
Más o menos 3, creo.
You only have 3 years with HHI now.
it? Okay.
Y Manuel, ¿usted lleva cuántos
¿Cuánto
años en Horizonte?
años? Tengo mucho ya.
He have a lot of years here in HHI.
Can he speak in Spanish to the merits of his appreciation for this organization? Can you say that and have him?
Manuel, ¿cómo usted se siente con Horizonte? ¿Cómo ha sido la experiencia? Con la doctora, con nosotros, ¿cómo usted se siente?
Bueno, la doctora ha hecho bien y yo me encuentro bien con ellos porque antes, cuando a lo primero sigo hablando o porque me están tomando la
perdón. Let's finish for him to take
Yeah,
it
yeah,
over.
it's gotta be that.
Le vamos a tomar, gracias, mano. Le vamos a tomar.
We don't want high values.
Have like a check-in with him.
Do you guys deliver the packets from
mío no es charla. Hay 3 manos aquí, ninguno es charla.
You sure? You sure?
So this is a patient of us. His name is Manuel. Manuel, ¿cómo está? ¿Y usted? ¿Todo bien? ¿Tanto tiempo? Manuel, él es Hugh
Ren?
y Ren. Ellos son 2 colaboradores de HHI. Entonces ellos están viendo el trabajo que hacemos aquí en el campo con los pacientes y eso. Entonces queríamos que la doctora le diera una chequeadita para que ellos vieran más o menos aquí su casa bonita y todo. ¿Y los ají todavía lo tiene ahí?
No, no, ahí se voy viendo.
Ah, la porra.
Ellos, conmigo de ellos, sí, hasta Joaquín. Vamos aquí.
Ajá, Joaquín.
So he have chili in the back. Chili peppers. He has it. He's joking. But he made them all.
He was on medication.
No. So he's not diabetes type 1. He's diabetes type 2. So he only takes oral. So metmorphine. Metamorphine.
He takes that?
Metformin. I'm sorry.
Yeah.
So Joandra, which is the health promoter here, Joandra visit him twice a month.
Yeah.
Just verify
Check
everything
in.
exactly. And Dr. Stephanie comes here once a month. So we try to strengthen here so we have leadership.
Ah, pero sembró yuca.
Sí.
Yuca, Manuel. ¿Y esto lo de arriba qué es?
Sí, dígame, mamá, ¿todo bien?
Estamos bien, gracias a Dios.
Qué bueno.
Mire, Manuel sembró yuca.
Also, this is cassava. He's harvesting cassava.
Oh, yeah, nice. Ooh, you like that? Yuca.
Ajá, yuca.
Me gusta mucho.
Nice to meet you.
Yes, thank you.
I thought you guys already knew each other.
No.
Okay, there you go.
I heard that you also do health clinics here?
Well, I'm a part of Melavea,
Melavea?
which is it's an overseas veterans program for veterans from the United States, and we do other stuff, to help. So a friend he was like I was telling him, he's like the mayor. He was like the mayor. He lived here like 25 years, and he helped this whole area. This was, he passed away. So I have a house down here. Raymond, oh, you know Raymond? That's my buddy. That's my buddy.
They're like brothers.
So I bought two of his houses, and RJ bought the other. You know RJ? Yeah. Very small world. So yeah.
A lot of cows and cattle. So in Pachomape, one of the challenges has been in terms of health access is again the systematic racism. Usually when patients, although the law says that public healthcare is universal for everybody. Some women, for example, if they're pregnant and they go to access, they want to give birth or anything, usually they are thrown out of the clinics. If there's nobody that speaks Creole, then they probably cannot communicate effectively. They don't have access to the SENASA healthcare service, health insurance, because they don't have the documentation. So we try to fill up that gap as much as we can.
Yeah. You need some translators, huh?
Exactly. So in our community health workers, half of them speak Creole because they are either Haitian or Haitian descent. Also within our staff, there are two people that are Haitian immigrants. One is Eliezer, which you guys already met, and the other one is Wilson Mateo. And this is one of the biggest Haitian communities here. So there's a lot of informal housing called barrancones.
Which, as you say, all stems from your sugar plantation.
Exactly.
Wow.
So they.
So how long ago was that? Shut down?
Aquí cerró el ingenio cerró en los 90. In the 90s.
Okay, wow, way back. Let's see, that's so far ago now. 20-something years ago. Madness.
Our community health workers, it's very important to have representation of Dominicans, patients, and Dominican-born individuals that have Haitian heritage, because that is basically the representation of the population that we work with. So at HHI,
and so many of them are not documented, right?
Exactly. So because they're not documented, they usually have a lot of issues regarding having access to health services. Although at the public clinics, they are not supposed to be denied services. That happen because of structural racism. So through the referral program and the collaboration with Dr. Stephanie, we go with them to the clinics to ensure that they are receiving the services. We provide translation. Usually on the workshops, we have materials that are bilingual. So that way we don't have any type of education gaps. And the way that, this is the front part of the... Right now on the the school for workshops.
Yeah, I'm gonna have to. We're gonna communicate a bit on email. You like to write in English or Spanish?
Yeah, both.
I like it both. Perfect. All right. Yeah, then we're gonna have to do that because there's a lot of them.
¿Van a comer el sí. Okay. Entonces we're gonna head to the Eliezer, she's
Colegio Las Llaves de Éxito. Education for the future. Aquí.
Entonces, esa es la razón por la que vamos a hacer.
Gente, le quiero presentar a Hugh Weber y al señor Ren. Hugh es el director ejecutivo de Salud 75 y Ren es del Dominican Today, del periódico. Entonces están conociendo un poco del trabajo de HHI y de ustedes, la vida de ustedes como promotores de salud, para que entonces acá en el país se conozca un poco de lo que estamos trabajando. So this is our community health workers. This is Dr. Stephanie. She's the clinical director. Dr. Stephanie is a family physician. She's also she's gonna be named the head of family medicine in the Ricardo Limardo Hospital. And Eliza is the leader of the community health workers. Y todos estos son los promotores de salud. Cada uno si quiere para que diga su nombre. Comenzamos con Johanna.
Mi nombre es Johanna, vivo en la comunidad de Arroyo de Leche y soy promotora.
Andra.
Mi nombre es Socorro de la Rosa y vivo en Los Gómez, en el barrio Villa Esperanza. Soy promotora.
Buenas tardes, mi nombre es Mariana Monterrey, también con los mayores y soy promotora.
Buenas tardes, mi nombre es Carla, vivo en los Altos de los Ciruelos y soy promotora.
Buenas tardes, mi nombre es Charlenis, vivo en Negromelo, Arroyo de Leche y soy promotora. Buenas tardes, mi nombre es Claribel y soy promotora de Horizontes de Salud y soy de Barrio Salud.
Buenas tardes, mi nombre es Carolina Hernández, vivo en Los Ciruelos, soy promotora de salud, HHI.
Gracias.
Buenas tardes, mi nombre es Antonio Félix, soy promotor de la comunidad de salud.
Buenas tardes, mi nombre es Ávila Carela Real, soy promotora de Horizonte y vivo en el barrio Sama.
Muy buenas tardes, mi nombre es Paulina, soy de Pancho Mateo y soy promotora.
Hola, mi nombre es Ciara, soy promotora de salud de Pancho Mateo. Buenas tardes, soy Soledad García, promotora de la Gran Parada, una comunidad cerca de Monteñar. Buenas tardes, mi nombre es Evelyn, soy promotora y soy de Barrio Tamarín.
Buenas tardes, mi nombre es Salud y soy promotora de Pancho Mateo.
Buenas tardes, mi nombre es Kissy, promotora de Buenas tardes, mi nombre es Dani, soy promotora de Pancho Mateo. Buenas tardes, mi nombre es Jaime Mercedes, promotora de Grupo Cangrejo, Alto de Chile.
Fantástico,
Any
gracias.
questions for Dr. Stephanie or the CHW?
Wondering, you do this each mes, every month?
Yes.
Okay, and it's usually this many or more?
Twice a month.
Twice a month? Okay. And hay la misma amount of people or más o menos?
Between this and 27.
Oh, okay.
Good amount of people.
Any questions for them?
I think it's pretty good. Pretty interesting. Just muy interesante. Nunca seen anything like this. Yeah. Yeah. So much.
For example, Joaquín, bueno, habla tú en español. Por ejemplo, tu vida.
Bueno, nuestra vida, por ejemplo, nosotros no tenemos horario, no tenemos, pero es porque nos gusta.
Yeah.
nosotros no tenemos la noche en el campo. Sí, porque sabiendo nosotros que una persona nos necesita, no podemos estar tranquilos. No es posible. Vamos allá.
So this is just an example of what a medication package looks like. This is prepared every month. So we put the name of the patient, the name of the community health worker, and then we put, if the patient doesn't know how to read or they don't speak Spanish or Creole, we usually have things in both languages. But for them to be a little easier, then we put a little sign either in the sun or the moon so they know what time of day they have to take it. So we stock it every month to make sure that there's no interruption in their treatment.
Wow. Comprehensive.
And I think we podemos ir ahora.
As more women get in, more come in.
Exactly.
Feel more comfortable.
Exactly.
In groups.
Exactly. So this will be basically the first gender perspective community-based program in the entire country.
Wow. Flagship.
So overall, HHI, through all of the programs, we impact about 1.2 million people from the 3 provinces that we work at. Here in Montellano, about 15 to 20,000 people. Through the referral care program, we have great relationship with hospitals and laboratories where they either give us a better price for analytics, and also we are right now moving forward into a new initiative which is turning HHI into a social enterprise, where we have built these agreements with insurance carriers, private and public, like Senasa, Humano, where we have a returning fee for the services that we offer to the patients that have insurance.
So what's interesting is the health is so connected to the infrastructure.
Exactly.
Those two things go hand in hand.
Exactly.
So you guys, in a way, are pushing forward the infrastructure attention
Exactly.
and calling that attention here.
Exactly.
So the gobierno, the government has to be involved in this.
Exactly. So that's why, for example, with these agreements, the government allows us to operate as a health.
Municipal.
Exactly. So, for example, at a national level, the Ministry of Public Health allows us to work as a health unit, a unit of primary health care.
Yeah.
And now at a municipal level, then we have agreements with the governor of Puerto Plata and Montellano in order for us to improve our outreach of the people that really have the needs. So with Movimiento Mujeres, for example, whenever we have this activity, for example, today's activity, they encourage other women to go to our health center in the rural area. And still, if women cannot reach our health center, then we go to the women's houses.
So now who is the laboratory under? Is that private or is it state in Puerto Plata? Laboratory where you do your...
It depends. For example, if at a public level, since Dr. Stephanie also worked at the Ricardo Limardo Hospital, she's gonna be the head of the family medicine in the Ricardo Limardo Hospital. She have access to patients that have Senasa or the state insurance. They can they can have their labs taken completely free.
Okay.
So the only thing that we provide as HHI is the transportation. So instead of taking the patients to the...
said about transportation.
Exactly. So instead of taking the patients to the health center, now we pull it. Dr. Stephanie goes to everybody's houses. She gets the blood test and then she takes it to the laboratory.
So she goes to the houses too.
So I want to show you, one thing is for me to talk, but now I want you guys to see other faces of the organization, and I want you guys to, we're going to take you guys to our health center and also to one of the workshops that right now is being
underway.
Exactly. ¿Cómo tú ves como el proyecto de Movimiento Mujeres impacta a las mujeres así desde tu perspectiva como
Perspectiva.
Bueno, este movimiento impacta directamente, nos impacta directamente, ya que por la vulnerabilidad de la zona, las mujeres no teníamos acceso, ya sea por transporte, relocalización, recurso económico para hacerlo en un centro privado. Entonces, de esta forma le estamos trayendo el servicio directamente a nuestro centro. Ahí vamos a tener ya el acceso directo con la población.
It's all part of the environment.
Yeah. Those were outsiders' comments. Comentarios.
Literally outsider.
So to add to what Ronnie was mentioning, here in Montellano, one of the challenges that we have, in the entire country regarding health is that there's no gender perspective. So there's a lot of diseases that affect women disproportionately.
That aren't getting attention.
Exactly. And it's just like Ronnie mentioned, it's just basic challenges like geographical challenges.
That's kind of
transportation.
worldwide, you know.
Exactly.
That's mundial.
Exactly.
Cannot situation.
Exactly. So, for example, through this Movimiento Mujeres or movement Mujeres, movement women, we call it movement because women are the ones that are investing in their own health.
Yeah.
So we train female community health workers to learn how to do pap smears, how the Papa Nicolau, how to do the physical breast examination, to give prevention and education workshops to the women in the community.
You know, in a way, healthcare and medicine is sort of like the women's baseball.
Exactly.
That's where girls can go.
Exactly.
In the health sectors, right?
Mhm.
I've seen that.
So in our health center, for example, we have 2 OBGYN doctors that they come every Friday, and we offer those services to women.
Where do they come
completely
from?
So one of them is Dr. Tatis Tavera. He was the former regional director of health, and he works at the Gregorio Hernandez Clinic in Puerto Plata. And the other one is Dr. Cedeño, which is the former director of the Gregorio Luperón de Montellano Hospital, and she also works at that clinic. So they offer their services for free for the women. So today and
Sex
tomorrow-
education is also part of it, is it not? Did you mention that in Spanish by chance?
So no. So part of the challenges that we have, for example, with women is because of the cultural thing, and also because in the Dominican Republic is a very sexist culture. Women usually don't have access to education or control over their bodies, so we try to have a safe space for women through cooperadoras or female community workers to really break that barrier so they can have a very comfortable conversation. We also have alliances with churches leaders, female churches leaders, pastoras, or the wife of the pastor, so they can also be part of involving their women that go to the churches into these clinical activities. Por ejemplo, con lo que estamos haciendo con los Papa Nicolau y eso. Sí, sí. The Sustainable, we did the analysis.
30 so far, right?
Hicimos cuántos filtros, 30,
Sí,
¿verdad?
30.
Están funcionando. Podremos mostrarle algunos.
Sí, we're gonna show
¿Y
you
cuántos
guys.
más?
Queremos hacer 100 para este año
100,
próximo.
sí.
We're gonna have 100 more. this
Lo que
next
sucede
year.
es que siempre se hace uno para 3 casas. Porque,
Okay, so uno por
sí,
3
porque
Okay, so 1 for 3 houses.
por la razón de que un filtro produce 3 botellones
Okay.
y una casa no consume 3 botellones, entonces el filtro necesita funcionar día por día
Sí, sí.
para que funcione. Hay que sacar.
Necesita mucha agua por día.
Sí.
Sí, each casa.
Si no, no funciona. Entonces necesitan muchas casas, entonces hacemos 3 para.
With Joaquin's program also, maybe you can talk about, puedes hablar un poco sobre las alianzas que tenemos, por ejemplo, con la Junta de Vecinos, con la asociación.
Sí. Nosotros trabajamos con lo que es la Asociación para el Desarrollo de Villa Montellano, trabajamos con lo que es el Club Rotary, trabajamos también con el CONANI, nosotros también presidimos lo que es la cabeza aquí en Montellano, los CONANI. También trabajamos con la Asociación de Juntas de Vecinos, nosotros damos formación.
¿Juntas de vecinos?
Sí,
Okay.
todas las comunidades tienen una Junta de Vecinos, son 30,
Okay.
ahora son 30. Nosotros capacitamos presidentes de Juntas de Vecinos, lo apoyamos a formar nuevas juntas. Entonces siempre cuando hay una nueva junta, una reunión, nos convocan, nosotros vamos, damos apoyo. Y entonces estamos conectados con todas las
¿Dónde
comunidades.
es laboratorio?
Laboratorio.
Laboratory? Yeah, for
analyzing the water. And,
¿Dónde fue el laboratorio para analizar?
Laboratorio Puerto Plata.
oh, okay. So it's,
Sí. Sí, se fue al laboratorio Puerto Plata y,
resultados está muy rápido.
sí, y en la universidad trajo un laboratorio y lo instaló en la comunidad por 15 días para probar todas las aguas y todas tenían problemas.
Hay muchos pedacitos en el agua.
Parásitos. Sí.
Hay mucha ameba.
Ameba, sí, sí, mucha ameba, mucha contaminación.
Y filtros
Funciona.
toman.
El filtro
Sí, lo elimina. Sí, lo elimina.
elimina.
Sí, le hicimos las pruebas, que las pruebas costaron más que lo que costaba el filtro y funcionaron muy bien.
Okay.
En 2 meses se le hace la prueba y funcionan bien.
¿Cuánto cuesta each filter?
¿Cuánto cuesta cada filtro?
El filtro, más o menos promedio unos 3,000 pesos.
$3,000?
Sí, pero incluyendo ya la
Pero
prueba.
una.
Sí, pero la prueba, incluyendo la prueba que cuesta.
Okay.
Una prueba cuesta casi 2,000.
So that's 3,000 pesos plus the testing. That
Yeah.
would be 2,000 pesos in addition, so 5,000.
A menos que montemos, a
And
menos
that takes care of
que
3
se monte
households.
laboratorio.
Households.
Exactly.
Okay, that's pretty good. So 5,000 pesos for 3 houses to be filtered with scaleless. I mean, there's a good, clean, potable water. Pretty important.
Very economical.
So, and the idea why we try to have it one per 3 houses is first, like Joaquin said, the filter produces a lot of water
Yeah,
now,
it's
so
efficient.
that's a sustainable way of sustaining 3 houses at the same time. And also, we want to also incentivize people to have that collaborative effort. Exactly.
Yeah, so they feel part of it.
Exactly. So the last 2 projects, I already mentioned the immunization program. Now we're going to have a refrigerator installed in our health center that we're going to see pretty soon. So the idea is that people can come to the health center and they can be vaccinated, and then we're going to report that data to the public health system. And that's because there's a gap in immunization in the rural area where people don't have access.
Health centers don't have enough.
No, and
Now,
also,
who supplies your vaccination?
¿cómo se llama? The DPS, the
okay.
Dirección Provisional de Salud.
Okay.
That's the immunization department.
Yeah.
So they have this book, the vaccination book, and every person that comes, then we have to sign that information, and every month we have to report to them the amount of people that we vaccinate just for quality control. And also we train the community health workers so they can go to people's houses, those that have issues with mobility, and then we do home visit and we vaccinate them in their houses.
Roger.
And the last program, which is very new, actually today we have the first women's health sheets where she just puts information regarding the adherence of the patient, just making sure that the patient is taking their medications correctly, that they are managing their glycemia levels or their blood pressure, how they are doing in terms of, for example, now with the COVID, we're doing a lot of mental health support for people that were fired from their jobs and they are trying to manage the situation. So I would say our motto is care beyond medicine, and ensuring that not only delivering medication is important, but also taking care of the patient in a very holistic way. So after the board saw that the necessity of coming 3 times a year was not enough, they decided to establish HHI in a permanent way. So our first office was located just behind this building, and then they decided to move here, which is a little bit of it's a bigger space. So with that, they founded the CHW program, and they identified the various cooperadores or promotores de salud here in the same communities that we were intervening, with the efforts of making sure that we were investing in the community, that we were creating employment outlets for people in the community. Although they were completely voluntary, they love what they do because they have a very deep connection with these are people. Exactly. Yeah. So, for example, I'm going to say it in English and Spanish. So, por ejemplo, el promotor ayuda al colmadero, ayuda al vecino, ayuda a su tío. So, they help the
Toda la comunidad.
exactly. So there's a sense of connection that other NGOs that have a community health program lacks, which is we try to identify people that can really our cause can really resonate with them and they have a deep connection within the community. And also we created a referral program where if a patient is identified with any type of risk, let's say they need to see a cardiologist or somebody outside of the primary care services that we offer, then we can connect them to the system.
Great referral
Exactly.
base as well is a big part of your program.
Exactly. So, for example, from last year to now, we had a lot of agreements with the Patronato de Cáncer, the Cancer Patronatos of Puerto Plata, and HHI is one of the few organizations that if we identify anybody with the risk of developing cancer or they are right now battling cancer, they can be connected to the service completely out of cost. So the patient never pays anything. That is because either HHI is funding that initiative or we have a strategic alliances with other institutions that can offer those services as well.
This is also why this rounds out so well with the convergence of this 360-degree view that they have, kind of again overlaying with English as a second language and the holistic nature of a player. And I think that's also not to put words in your mouth, but one of the reasons why Dr. Eliezer was so interested in partnering with the pitch was because of that outreach through the player to his community and his whole family.
That's talking about connection. That's the whole thing, right?
And the whole family. That's why we're inviting people to come, and you have to bring two influential family members outside of the player.
It kind of is baseball.
Exactly.
It is the community.
It is.
And it's the kids, and it's just that's it.
It is. And we have found, for example, through the Salud program, we at some point we had this pilot project with the soccer team in one of our communities, and we found that through sport there was a lot of ways where we can teach kids how to adopt healthy habits into their lives. They can stay out of problems. They receive an education. They have like a purpose or things to do.
Yeah, the future.
Exactly.
Preventative.
Exactly, and bringing in opportunities for them, which is very important.
And they're open to learn at that time too.
Exactly.
That magic moment happens.
It's important. It's
You're in the
critical.
field.
Exactly.
You reach them young, and then you have good habits for life.
So after a couple of years, then we opened the Healthy and Happy program, and basically
What year was that?
that was
it 2005, 2000.
That was
Now you're 10
2013, if I'm not mistaken.
Starting in 2012.
But they just had their 10-year
So we were
anniversary, right?
exactly. So we were founded in 2009 in Connecticut. We were incorporated in the DR in 2012. Exactly. So through San Feliz, what we do is that we create support groups within the communities of people that are either living with a chronic disease or they are at risk of developing one. Let's say if I go to the community and I see Urbania and I take Urbania's glycemia and I see she might have a prediabetes condition, she's not eating properly, she is not working out, and she have an interest of changing her livelihood, then we enroll her in a support group where a community health worker and Dr. Stephanie work in collaboration to teach them how to eat properly. So you have 6 areas. It has nutrition, it has mental health, community development, where we try to integrate them in participating in activities that are going to develop their communities. They have a social empowerment portion of people that they don't have employment, and we work on collaboration with other institutions and other organizations to have community gardens that they can harvest that and then they can resell it. So the idea of San Feliz, or healthy and happy, is that it's not only about the medication, but it's also being healthy and happy involves a lot of things. With that, then we open Joaquin's program, which is the community development program.
Would it be possible to have both of your co-members here speak to the merits of their program, even if it's in Spanish? It's fine.
Sure.
Both standpoint, whatever you would deem.
Of course.
And I can't cut out on this, so don't worry.
No, it's fine.
But it would be great, other than your wonderful words, to have both of them speak in Spanish comfortably about one of their best competencies or best favorite parts of the program?
Of course, perfect.
Okay.
So let me have him. But just to give you an example before Joaquin comes, basically we work around 5 areas. One is sustainable housing, which we do improvements on the flooring, windows, doors, and the houses. We have a lot of patients that have asthma, and for example, if their floor is made out of dirt, then they are never gonna improve their condition. Also, we work on recreation and cultural heritage, which is making sure that the community have access to parks and places where they can play. We work on sanitation efforts and clean water efforts. We have built a couple of water filters where we train the community members on how to create their own filters, and we take the water to the lab. So we have a couple of people that I don't know if the number is 30 filters so far that we have built it, and this upcoming year we have a goal of having 100 filters built.
That's phenomenal, isn't it?
Yeah, that's why I
Really something.
want to partner with them. Why we
And the last 2 projects before Joaquin, Juaco, Juaco, aunque sea en español, even it's in Spanish, right?
Yeah, yes.
So, Juaco, para que tú hables así libremente de lo que tú haces en tu programa como componente comunitario, los pisos, los filtros, todo.
Bueno, nosotros trabajamos lo que tiene que ver el área comunitaria, con los pisos de cambio de piso de tierra por cemento. Trabajamos lo que es los filtros, que en la comunidad le hace mucha falta porque el agua no es potable. Trabajamos esa área, lo que es los techos, la pintura, lo que es la comida, alimentación para las personas que la necesitan realmente. Y un sinnúmero de cosas, huertos escolares. Trabajamos esa parte, trabajamos también lo que es las juntas de vecinos, damos apoyo, formación de grupo, y entre otras cosas.
Y lo de los filtros, háblale un poco del proyecto.
Bueno, los filtros, nosotros trabajamos con la Universidad de Estados Unidos, los cuales vinieron aquí al país y duraron un promedio de 1 mes capacitándonos, y tenemos un personal capacitado para hacer los filtros. Son bioarena, y los cuales tenemos un proyecto piloto que está funcionando hace más de 2 años. Se le hicieron la analítica, funcionan a la perfección, y seguimos trabajando haciendo más filtros.
And again, that's due because there's a lot of gaps in terms of accessing to clean water.
Yeah.
There's a lot of water deposits
Again, the
and it's dirty.
infrastructural
Exactly.
issues.
So we're working very hard on educating the population. The first
2
one,
agreements, sorry, one with the Ministry of Public Health
the
and one with...
Yes, so the agreement with the Ministry of Public Health, we have a special program financed by the World Diabetes Foundation where we train doctors, nurses, and community health workers from the public health system in the Puerto Plata province, the Espaillat province, and the Santiago province.
That's
So,
Plutarco.
exactly. So here in HHI, we supervise over 176 units of primary care across the 3 provinces. And since strengthening the public health system is one of our goals, the way that we do it is we train family physicians in the public health system in order for them to improve diabetes and hypertension care. So each year we train, depending on the amount of doctors, we train about 40 doctors, 40 nurses, 40 community health workers from the public health system.
Specialists?
Family physicians.
Okay, so GPs.
Exactly. So, for example, let's say I am a family physician and I see that somebody that is coming to my consultation have problems with their teeth, then I know that might be an indication of a pre-diabetes condition. So that way I have a better management and I can refer them to a diabetologist in that sense. So that is what we do at a national level. The idea is that all of the programs that we have internally, the chronic care program, the healthy and happy program, and the community health workers program is going to be scaled in a national level. So we picked 176 units of primary care that we supervise each month in order to ensure that they have their best practices in terms of diabetes, type 2, and hypertension care.
Now, with this diabetes and hypertension, is obesity also an epidemic?
Of course.
Is that
So,
from diet changes or from sedentary?
it depends, because for example, here in our culture, there's a lot of fried food.
Yeah, starches.
There's a lot of starches. There's a lot of people are very sedentary. So
So
usually
it's kind of traditional.
exactly, and people usually associate that eating healthy or exercising is something that is gonna take a chunk of your time.
Yeah.
So, for example, when
It
you
does.
look into our population, you have people that have access to organic food, organic vegetables, but they don't know how to prepare it. So, for example, us through the Healthy and Happy program, when we teach people how to eat healthy, we're not taking away your rice or beans. We're just telling you how to eat in portions or
Nutrition
how to prepare
counseling
it.
or-
Exactly.
Yeah.
So the way that we do that is we design, let me show you a couple of
Does the public seem open to that?
so with the Salud for this program, we identify the people at risk, and the way that we do it is, let me show you an example of one of our patient's record. We fill two forms. The first one is a socioeconomic form that is gonna give us a data of the level of need of the person that we are gonna be intervening, and then we do a risk factor form that just showcase if the person smokes tobacco, if he drinks
Lifestyle
alcohol,
habits.
exactly, and that way we can adapt the type of intervention that we're gonna have. So let me show you some of the strategy that we do.
They had a number of those files stacked up on the desk in there, so
Yeah.
I want to ask exactly how many cases you manage.
Your clinic of 500 people in 5 days, too, right? That's pretty
So for example, we use
yeah.
this is like the for the diabetes day that was in November 14. So this is the rice and beans and salad in a normal plate of a Dominican household, but we try to put it on portions. So we did that in collaboration with the Ministry of Public Health, and we have
World
a lot of
Diabetes Day, yeah.
we have a lot of resources that we they are designed here in the office, but they are applied at a national level. For example, the Community Health Workers Manual that was created in the HHI is the one that they use in the entire Dominican Republic.
Pretty
That's
healthy,
impressive.
though, if it's organic, and chicken, pollo, and habichuela.
Exactly.
Coming from the United States, most of the people that we have observed, my wife and I have observed here, are very healthy and in great shape.
Yeah, there's good fiber.
I mean, you go to the United States, there's a lot of out of
Exactly.
shape people, lots of the McDonald's and the Burger King.
Yeah, that's a lot.
Here, at least, there's always healthy.
Exactly.
But,
So
but
still-
sitting around is not good.
exactly.
Everybody getting locked in now, they can't move around.
Right, but you're talking about the starch diet and the fried food too, which you know.
Fried.
So we have that agreement with the Ministry of Public Health, and also we have the habilitation, which allow us to operate as a clinical facility or a health center. With that, that allow us to do consultation, home visits, medication delivery, training, prevention, education on health outcomes. Activities that minimize or educate the population about non-communicable chronic diseases.
¿De quién es esa?
So this is from the Ministry of Public
It is,
Health
that's what I
also,
thought,
but it's also supported by the National Health Service, the SENASA, the Servicio Nacional de Salud. And also.
Now, do you have really good relationship with these guys? Are they pretty communicative?
Yes. For example, the way that we operate, I wanna say that we operate completely private. I mean, we don't have support from the government in terms of funding or in terms of medication or anything. However, because we are right now closing a gap in terms of managing the units of primary care and supporting the government efforts on minimizing the entities, they are very supportive in terms of allowing us to expand and work.
And you started under, what's his name before it was Cardena, or what was his name, the former minister?
El ministro pasado se
Yeah,
llamaba
under Medina.
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 No, el presidente. Danilo Medina, you mean?
I think it was Cardena or something, wasn't it?
The focal for
So this project,
minister?
so we have been habilitated since 2012, and 2012.
2012? Okay.
Yes.
Yeah, so that was him.
So,
But have you noticed much change in the administration? Are you getting more connection now?
I think we all have always have a very good relationship with everybody that has been in the ministry and Cardinal.
That's it, yeah.
So we have always have a great relationship with people at the Ministry of Health.
Yeah.
Either supporting the efforts that we do through this project or other projects. They have always been very excited in terms that I think the way that we design our strategic plan is also supporting the national efforts. So the way that we work in HHI is not that we're blind. We're part of this platform of the things that the government is doing and that us as the private sector.
But they dovetail into what the public is provided through the national government, and then it's an overlay and extension, supplementation.
Outreach extension.
So, for example, the way that you see that relationship now, we have a new community immunization program that just started. I think el programa de inmunización lo firmamos hace como 2 semanas.
Immunizations.
So, through this new immunization program, we are working directly with the Ministry of Public Health, and HHI is going to be in charge of vaccinating people in the rural area.
The rabies is a big
Exactly.
deal.
So and especially now with the heat.
Yeah.
So
is that getting under control a bit now?
I would say yes. I think
it's also a big problem right now.
Exactly. And I remember, I don't know if in Santiago or Santo Domingo, it was an outbreak a couple of years ago also.
But that's coming.
Yes, definitely.
And how about the dengue?
Well, dengue, malaria, and mosquito-related diseases are very high in Montellano, and one of the reasons why that is because
Hurting myself.
Mosquito spray. Is that all for mosquito spray?
There's quite a lot.
Repellente? No, that's for the bugs.
Okay, are you spraying?
Supposed to put that on the bugs, not you.
So because of the water accumulation and there's a lot of issues regarding access to clean water and sanitation. There's a lot of mosquito-related diseases. So I think on December now we're gonna start an issue, and I think our goal is to also design a prevention and education.
Our values, our mission, our vision. We recently repainted the office after being here for 10 years. This is part of the services that we offer. This is certified by the Ministry of Public Health, and we are habilitated as a clinical consultation office through Dr. Stefan, which is our clinical director.
To just take one step back, we're here with Dr. Eliezer Lappots, who's the director of this office, as well as his staff. Maybe a quick introduction of these two.
Yes, so Joaquin is our community development coordinator, and Urbania is our operations and financial director.
Fantastic. Okay, and you were continuing.
Yes, so following to one of the offices of our staff member, so we have the office of our program director and monitoring and evaluation director. Here in the closet we store the materials that we use, lancets, strips for the glucometers, and anything related to the World Diabetes Foundation program, and the Healthy and Happy program, the HID program, and the Community Development program. So it's a very small space, but we do a lot of work. So our second office is the program coordinator for the Healthy and Happy program and the office of the Community Development program, Community Health Worker program. I'm sorry.
These are some of the case files.
Yes, so I'm gonna show you an example later of what is an example of how it looks.
Perfect.
A little bit of what Dr. Stephanie does. This is the office of the clinical director and the referral program coordinator as well. So here we have in a closet. Here is where we store some of the medication.
Look at this room.
Usually for MSDs or for monthly activities, what we do is that we have a package where Dr. Stephanie with the community health workers coordinator and some of the CHWs, they pack all the meds for all the patients that we're going to be delivering that to the communities. So we have 27 community health workers. All of them are trained to do vaccination, primary care services, chronic care. They create workshops where they have about 10, 12, 15 patients each, and each month they give them counseling, they teach them how to eat properly. So they are basically nutritionists, counselors, psychologists, nurses, all of them in one package.
Amazing.
Yeah.
The main difference between us and other NGOs that have a community health worker program is that we are one of the few organizations that select CHWs from the same community that they are going to work. So they have a they're more connected
homegrown
to the
interest.
Exactly. So.
And I also want to make sure, not necessarily at this moment, that we talk about the differential between the overlay of what the government provides and where you fill that gap with what they don't provide.
Perfect. So these are some of the activities that we have done related to the diabetes day. For HHI, we have organized over 3 activities each year in November. One was a diabetes walk, or a walk for diabetes. Because of COVID this year, we had a couple of limitations. However, we were able to do some activities virtually. So let's go to the main. This is where we have our meetings, and we have some of our, we have lunch, so it's like the common room for all of our office.
Seems like diabetes, by the way, is a really key focus of yours, just by virtue of the number of posters and
Correct.
times you brought that up and our research.
So for example, HHI, although we specialize in community health, our approach is on non-communicable diseases with a concentration on diabetes and hypertension. So right now in the country, we are the only organization in the country and in the Caribbean certified by the International Diabetes Federation as a center of diabetes care excellence. And we are the number 4 in the entire American continent, followed by Colombia, Brazil, and Argentina.
Very, very impressive.
Hypertension's pretty big now too, isn't it?
Yes.
Kind
so
of on the rise.
I will say.
Now, why do you guys think things are getting rising here? Why is diabetes and hypertension rising?
So the situation is here in the Dominican Republic, for example, some of the challenges that they have regarding non-communicable diseases like diabetes and hypertension are the habits. The eating habits, the lack of exercising. You're going to see that a lot of our population face a lot of challenges.
Sedentary.
Exactly. So it's a very sedentary life. They don't have access to places where they can exercise. They don't have public parks. They don't have, now with the COVID, they have to stay at home. Some of them don't
everything's
have
getting exacerbated.
Exactly.
Yeah.
So for those that already are living with diabetes and hypertension, some of the challenges are that they don't have unemployment, or they depend on informal economies like selling goods, like
stress
food.
is-
Exactly. So stress is very high. They don't have access to eating healthier food, or they don't have access to pay for their medication. So that amplifies the gap in ensuring that they have a dignified life.
Now, there's no way to get the health centers to carry medicines for this.
Exactly. So we're gonna go right into that. So
What about Plutarco Arias? Are you guys in connect?
yes,
coordinating
so
with
we had a meeting with Plutarco Arias, I think at the beginning of en la reunión con Plutarco que hizo Sheila fue hace como un mes, ¿verdad? Sí. It was like a month ago.
Yeah, I saw him a month ago out at Maria's. They were doing protocol checks with David Collado.
So I'm gonna show you guys a little bit of the strategy that we have in terms of the private operations of HHI and the alliances that we have with the government. So let's go over here.
Interface.
So this is supposed to be my office, so we're now renovating it, and I'm just using some of the space. So if you guys can sit here, and I can talk to you a little bit more.
You got the office that opens to the courtyard, huh? That's nice.
So for activities, usually when we do the planning or we do any type of meeting regarding an MSD, a medical service trip, or we have monthly visits, we usually do all the planification here. So this is the plan for the health fair of 2021. And this is gonna be on January. The idea is that we're gonna impact over 500 people in 5 days. And we're gonna do 500 people, yes. So what we're gonna do is we're gonna have a vaccination event, jornada de vacunación. We're gonna have OBGYN services for vulnerable women. We're gonna have HIV testing and ETS testing, diabetes, hypertension, and non-communicable diseases care, medication delivery, vitamins, pediatric services, and usually we don't have prevention and education activities at the same time, but in these occasions we're gonna do it. So because of COVID, of course, we're gonna have limited space with limited people, and they are gonna have appointments at certain times, so that way we
Like clinics.
exactly. So let me show you.
What do you guys call that? Clinicas or?
So
Seminar?
for so